Well, so this afternoon, there's a nationwide shortage of vaccines for poliomyelitis in Ghana. Now, the infection caused by the polio virus hit a severe year high in 2020 when the country recorded nearly 700 new cases, up from 376 in 2014. In response, the Ghana Health Service increased its polio vaccination campaign to get more persons immunized. But the country's shortage is experiencing some shortages, which is threatening obviously our targets as a nation. Joining me now is Manuel Kranting, who is with our health desk. He's been following up on a number of issues that are coming up with Joy News is learning about. First of all, Manuel, let's start from the issue of the shortage that we are hearing of. How did we even get here in the first place? I guess that's the question a lot of people are asking there.
Indeed. So in the past month or so, many of the health facilities across the country began to experience this particular shortage. So there's a cold chain, a vaccine cold chain across the entire country where the expanded program on immunization of the Ghana Health Service actually collects and then transports these vaccines across the various regions. In the past month, we're told that the flow of the vaccine from the manufacturers indeed cut, and so they're not coming into the country, which obviously meant that the health facilities which depended on these vaccines to immunize newly born babies and so on and so forth were not going to get their vaccines. And you know that the polio virus, or if you like, the poliomyelitis itself affects babies really under 5-year-old children mostly, and so these are the most at risk.
So external factors largely.
And that's what we've been told. But at the various health facilities that we have visited, particularly here in Accra, we're told that especially mothers and so on, lactating mothers, they're told to return sometime later, this month or so, for the vaccination, because obviously the vaccines are in short supply.
I'm sure that you've been making further checks about the implication on the health of a child, for instance, if you don't get that vaccination.
So, I mean, quite fortunately for us in Ghana, we don't have the really severe, cases of poliomyelitis. So, mostly what we have are the type 2 polio, which is hardly even symptomatic. But you don't want to take chances. The reason you'd have to run these vaccination campaigns and have almost all the population which is at risk, vaccinated. And so that's what you have. But typically you have, paralysis in a very extreme instances. Paralysis in the leg, in the arm, and so on and so forth. And there are people. There's a 1%, as it were, projection of people who actually may lose their lives if they contract the.
Let's talk about the Ghana Health Service and what they are doing about this to contain this situation. Do we know exactly what steps are being taken in that regard?
Indeed, I've spoken to the head of the expanded program on immunization at the Ghana Health Service, Dr. Kwame Amponsa Achiano, who tells me that the reason you had this shortage is that Ghana actually was moving away from its old manufacturer who had which had problems, producing the vaccines, and so there's a calculation of about 6 weeks or so, which ended up in this shortage. But we're told that they've reverted back to the manufacturer, and by next week, as we're told, by next week Monday, or at least by the beginning of next week, these vaccines will touch down in Accra.
Manuel Kranting, I'm grateful. We can now listen to Dr. Achano explain further in this interview with my colleague Manuel Kranting.
So the current shortage came around, I think, about a week or two ago, and we've been struggling, or we've been working hard to get polio into the country. Come Monday, we'll receive polio.
But you're saying Monday, and then we'll take you Monday, on that just briefly. But what was the reason for the shortage? Is it a global wave of shortage, or what exactly?
No, it's not a global wave. We had an issue with the manufacturer.
Okay.
We were in the process of changing the manufacturer, but then later on we were advised that if we had to change that, we needed to get another kind of approval, and so it would be a complex thing. So we went back, and the manufacturers now, in fact, there was shortage there, and so we wanted to move away.
Okay, so the manufacturer that produces for Ghana.
Yes, for the one we tapped into, yes.
Had a shortage,
yes.
and you wanted to move away.
Yes.
And that was the reason for the shortage. That
yes, so we have had a long period of discussions and trying to get them to produce, and so now it's ready for pickup.
Okay, so when are we getting it?
On Monday we should get.
That's Monday,
no, you know, it's a long process. You see, first of all, it's not that simple. You need to do what we call a forecast for 2022. Normally you do that in the previous year. So we did that in 2021. Somewhere in November, that's when you plan for your consignments. And they normally have lead times, 6 weeks, 8 weeks, sometimes can go to 12 weeks. Before they can produce, you know. It's not a simple production like you go to the market and then get it. So it's a very complex process. But fortunately, the bottom line is that we are getting the vaccines by Monday.
I guess the question would be that, especially because we do forecasting, one would have thought that would have been able to preempt this gap before, you know, move away and all that.
That is very true. So we predicted this about almost 6 weeks ago. And we started working on that. And so it's taking us a long time to get here. It's not just an overnight thing. Because if you have shortage in, let's say, 2 weeks and you get a replacement, lead time sometimes 12 weeks. So what it means is that the production started earlier on. And so it's not I wouldn't say it's a very short.
Well, we've checked a few of the hospitals. I mean, maybe I'm not going to mention the names of the hospital, but a couple of the hospitals tell us that they had the shortage sometime around May into June, and that's
exactly what I'm saying. That about 2 weeks.
Okay. Well, let's now talk about the implication of the shortage for mothers and so on who are looking to vaccinate their babies and all of that. What was the implication for them?
Well, the implication going forward is not an issue. Previously, I mean, looking back, probably if there was a wild one lurking around, then probably you'd probably get an outbreak or something. But normally it doesn't work like that, because we still have a vaccine that protects against polio, which we are still continuing. And so the implications will be that, well, if we had had it earlier, it would have been better. That's all.
So there's no.
And then also the fact that mothers will have to come
again
back. Yes, that's it.
So there's no imminent threats. That's the assurance.
For me, no. There's no imminent threat because we don't have the wild polio around. If supposing we had, let's say, an outbreak in the sub-region, for example, of course we would be worried. But again, it's the first timers. Remember, polio is given 4 times. It's those who are born new, then 6 weeks, 10 weeks, and 14 weeks. So people would have had maybe 2 doses or 3 doses already. There's no imminent threat, but you don't want to take chances, and that is why you need to move heaven and earth to get polio as early as possible.
But the assurance is
that's exactly
what we have it latest 20th June. We have
Monday. Monday. Yes, because we've received before you get a vaccine, you receive what we call the alert. We received the alert, and even this morning we're with UNICEF, who does the procurement, discussing and about the distribution and all that. So we've done distribution on paper. As soon as it arrives, it will be carted to the regions. So there's no cause for alarm.
Well, it appears that this issue goes beyond the national capital, Accra. Martina Bugre is joining us from her center base, where, of course, she's been checking some other health facilities in the northern parts of the country. Martina, what do we know about the situation up north? Martina, if you can...
For the past 2 months, yes, I can hear you.
Right.
For the past 2 months now, parents who have tried to get their children vaccinated have been disappointed. Several health centers that I have personally checked you go and we are told that they are waiting. I mean, they've been told that it's out of stock and they are waiting anytime it comes. I met a couple who were trying to get their daughter to the Upper East or Upper West to have the child vaccinated. That's how come I got to understand that it was a serious issue. There wasn't any stock for a long time and parents are worried. Now, having educated people a lot about the dangers of not vaccinating their children, parents are aware. And that's why it's become an issue that they think that government should address.
How about the management of the various facilities that you've been visiting? Are they putting in place some alternative measures or trying to assure persons who are trying to access these vaccines?
Now, when you go, they will refer you to the public health director, and he says that they have written, they are expecting some, as and when it comes, they would have stock. But right now, it looks like it's a shortage nationwide.
And what more assurances have you been getting from the director up north?
He says that for the past 3 months now, it looks like they are just waiting and hoping that something comes up. No assurance. He can't guarantee that it will come today or tomorrow.
Martina, thank you.